Hi, my name is Victoria Hugert, second semester ADN student at University of Charleston, and this will be my assignment for administering oral medications. So the first steps will be the same for all. I'm going to go ahead and say those and get them out of the way. You'll want to gather your equipment, check the medication order against the EMR according to the policy of the facility, check the medical record of the patient for allergies. You should know the actions, considerations, the purpose of administration, side effects, and safe dosage ranges for all of the medications to be administered. You'll always perform hand hygiene. You will move the medication to the outside of the patient's room or prepare them for administration if you're in a medication area. Or you can also, next you will unlock the medication supply drawer. You will enter in a passcode if required, use a key to unlock the unit if needed, use your identification, and then you will only prepare medication for one patient at a time. You'll read the EMR and get the medication that's due for dosing, and then you will compare the medication label to the EMR, check the expiration date, perform any calculations that are needed, and you'll either sign out the medication that it's been given, scan the barcode on it, whatever the policy's procedure is. When administering oral medication, you will not open the wrapper of the medication until you're at the patient's bedside, and you will want to keep certain medications like opioids and special nursing assessment medications separate from your general medication. If you have a multi-dose bottle, make sure that you pour the necessary number into the bottle cap and place the tablets in the medication cup. Only break tablets if they're scored, and do not touch the tablet or the capsule with your hands. If the medication is a liquid, when you're pouring those out, you want to make sure that you hold the bottle so the label is against your palm. That way the medication doesn't run down the side of the bottle, making it illegible. You will use the appropriate measuring device when you pour your liquids, and make sure that you read the amount of medication at the bottom of the cup or the dosing unit at eye level, and you'll want to wipe the lid of the medication off with a paper towel to avoid it from sticking. You will replace the multi-dose containers back in the patient's drawer or the medication supply system. You'll always want to make sure that that's locked if you're not there to use it. When you're transporting the medication to the bedside of the patient, make sure that you keep the medication in your sight at all times, and then you also want to make sure that the patient gets the medication at the correct time. Of course, you'll perform hand hygiene and put on any PPE that's necessary. You'll identify the patient by using the information within the EMR. The patient should be identified by using at least two of the following methods. You'll want to use the identification band, the identification number on the ID band, the birthday, ask the patient to state his or her name, and the birthday. You'll want to scan the patient's armband to activate that, assist the patient to an upright position if they're not there already, and then administer the medications. You can give them water, or if they have a drink at their bedside that they can use, you can ask the patient if they prefer that they put the medication in their hand and take it that way, or if they take it straight out of the cup. You do want to stay with the patient to make sure that they take all of the medication. Do not ever leave medication at the patient's bedside. You have to watch them take it. After they're finished, you can put them back in a comfortable position. If you had on any PPE, go ahead and take that off. Do your hand hygiene before you exit the room. Then you'll document that you administered the medication immediately afterwards and evaluate the patient's response within the appropriate time frame. When removing medication from a vial, you should remove the metal or the plastic cap on the top of the vial that protects the stopper. You should always clean that with an antimicrobial swab or an alcohol wipe and allow that to dry just in case there's been any contamination. You'll remove the cap from the needle by pulling it straight off. And then if you're using a multi-dose vial, make sure that you touch the plunger only at the knob and draw back an amount of air into the syringe that is equal to the specific dose that you're going to be using. If the vial is a single-use vial, then that is not necessary to be completed. You'll want to hold the vial onto a flat surface Pierce the stopper in the center with the needle tip and inject the air into the solution, above the solution. Do not inject air into the solution. If the vial is a single use, again, then that's not necessary. Then you invert the vial and keeping the tip of the needle below the fluid level. You'll want to hold the vial. If there are any air bubbles present in the syringe, you'll want to tap or flick the barrel to remove those air bubbles. After the correct dose is withdrawn, you'll want to remove the needle from the vial and then carefully place the cap over the needle. Some facilities require that you change the needle once it was used to withdraw the medication. You'll then want to check the amount of medication that you pulled into the syringe and discard any extra. You will then perform hand hygiene and proceed with administration. When mixing medications from 2 vials into 1 syringe, you'll remove the cap that protects the self-sealing stopper on each vial. If the medication is a suspension, you will want to make sure that you agitate the vial to mix it well. Scrub the top of the stopper with an antimicrobial scrub or an alcohol wipe to clean it. You'll remove the cap from the needle and touch the plunger only at the knob and draw back the amount of air into the syringe that is equal to the dose of the modified medication to be withdrawn. You hold the modified vial on a flat surface. Pierce the stopper in the center with the needle and inject the measured air into the space above the solution and withdraw the needle. Then you'll draw back the amount of air into the syringe that is equal to the unmodified dose to be withdrawn. You'll hold the unmodified vial on a flat surface, pierce the stopper in the center with the needle, and inject the measured amount of air into the space above the solution. Invert the vial of the unmodified medication. Hold the vial in one hand and use the other to withdraw the medication by pulling the plunger. Turn the vial over and then remove the needle. Check that there are no air bubbles in the syringe. If so, you can flip or tap on it to make those go away. Check the amount of medication in the syringe with the medication dose and discard any extra. Recheck the vial label with the EMR. Calculate the endpoint on the syringe for the combined amount of medication by adding the number of the units for each dose together. Insert the needle into the modified vial and invert it, taking care not to push the plunger and inject the medication that you've already pulled up in the syringe into the medication that you're getting ready to pull up. You'll hold the vial in one hand and use the other to withdraw the medication. Turn the vial over and then remove the needle. Carefully recap the needle. You'll check the amount of medication in the syringe with the medication dose and label the vials with the date and time opened and the beyond use date. Store the vials containing the remaining medication according to the policy of the facility. Make sure that you lock the medication supply system, perform hand hygiene, and proceed with administration. When administering an intradermal injection, if necessary, you'll withdraw the medication from an ampule or from a vial. Sometimes the medication will come in a pre-filled syringe. You'll transport the medication to the patient's bedside, keeping it in your sight at all times. Always be sure that the patient receives their medication at the correct time. Perform hand hygiene. Identify the patient using the EMR. The patient can be identified by checking the name of the ID band, checking the ID number on the band, checking the birth date and the patient's identification on the band, or ask the patient to state his or her name and birthday. Close the door to the room and pull the bedside curtain to provide privacy. You will scan the patient's barcode on the ID band, put on clean gloves, and select appropriate administration site. Assist the patient to the appropriate position for the site that's chosen. You can give them a drape if necessary. Clean the site with an antimicrobial swab or an alcohol pad while wiping with a firm circular motion, moving outward from the injection site. Be sure that you allow the area to dry. Remove the needle cap with the non-dominant hand. Spread the skin taut over the injection site. Hold the syringe with your dominant hand between the thumb and forefinger with the bevel of the needle facing upwards. Hold the syringe at a 5 to 15 degree angle from the site and place the needle almost flat against the patient's skin, bevel side up, and insert the needle into the skin. The needle will only be administered about 1/8 of an inch with the entire bevel under the skin. Once the needle is in place, steady the lower end of the syringe. Slide your dominant hand to the end of the plunger and slowly inject the agent while watching for a small wheal to appear. Withdraw the needle quickly at the same angle that it was inserted. Do not recap the used needle and use the safety shield or the needle guard. You don't want to massage the area after removing the needle and tell the patient not to scratch or rub the injection site. You can blot the site with a dry gauze square if necessary, and do not cover it with a bandage. You can get the patient in a comfortable position, discard the needle in the appropriate receptacle, remove your gloves, wash your hands, document the administration of the medication immediately after it's given, and then be sure to evaluate the response to the medication within the appropriate time frame. You'll want to observe the area for signs of a reaction at determined intervals after the administration and inform the patient of the need for inspection. When administering a subcutaneous injection, you will want to pull the medication from the vial or the ampule unless it comes in a pre-filled syringe. Then you'll transport it to the patient's bedside, keeping it in your sight at all times. You'll perform your hand hygiene and use PPE if necessary. Check the identification of the patient by using the name on the ID band, the ID number on the ID band, using the date of birth on the patient's ID band, or ask the patient to state his or her name and their birthday. Close the door and provide privacy. Scan the barcode on the identification band of the patient. You'll want to put on clean gloves and select an appropriate administration site. Assist the patient to an appropriate position for the site that has been chosen and drape the area as needed. You will make sure that you have identified appropriate landmarks for the site that you choose. You'll clean the area around the injection site with an antimicrobial swab using a firm circular motion from at the injection site out, and allow the area to dry. Remove the needle off the cap by pulling it straight back. Create a skin fold by pinching the area around the injection site. Alternatively, you could pull the skin taut, and that's based on the assessment of the patient and the size of the needle used for. You'll hold the syringe in your dominant hand between the thumb and forefinger and inject the needle quickly at a 45 or 90 degree angle. If you're pinching the skin, once the needle is inserted, you can release the skin and stabilize the base of the needle to avoid injecting into compressed tissue. You'll slide your dominant hand to the end of the plunger and avoid moving the syringe. You'll inject the medication slowly at a rate of 10 seconds per ml. Withdraw the needle quickly at the same angle you used for insertion. Do not recap a used needle. You can engage the safety shield or the needle guard. If blood or clear fluid appears at the site after withdrawing the needle, you can use the gauze to wipe it clean, but do not massage the site. You'll get the patient back in a comfortable position, dispose of the syringe in the appropriate receptacle, remove your gloves and any additional PPE, perform your hand hygiene, always document administration of the medication immediately afterwards, and evaluate the patient's response within the. For performing an ear irrigation, you will first want to perform hand hygiene and use the proper protective equipment as needed. You'll need to identify the patient by checking the name on the identification band, the identification number on the band, the birthday on the band, and ask the patient to state his or her name and birthday. You will scan the barcode on the ID band and assemble all the equipment at the patient's bedside. You will have the patient to sit or lie down with the head tilted toward the side of the affected eye. Protect the patient and the bed with a waterproof pad or a towel. You'll put on gloves, clean the patient's lids and eyelashes with a washcloth with some sterile saline or normal saline or water. You can do that with the order for the irrigation. You always wipe from inner to outer and use a different corner of the washcloth with each wipe. You'll want to wear a face shield to keep anything from coming back and getting in your eyes or on your face. You'll place a curved basin at the cheek on the side of the affected eye that's going to be receiving the irrigation, and you can ask the patient to hold the basin if they're able to do so. You can put your thumb near the margin of the lower eyelid, right below the eyelashes, and then 2 fingers above the eye and apply pressure to pull down on the bottom and up on the top to open the eye. You will fill the irrigation syringe with the prescribed irrigation solution and irrigate until the solution is clear or until all of the solution has been used. You should only use enough force to cleanse the eye. Don't use excessive pressure and avoid touching the eye with the irrigation tip. You can have the patient to close their eye ever so often to periodically during the procedure to see if they feel any type of relief. Afterwards, you dry the area around the eye with a sterile clean gauze or offer the patient a towel if their neck or their face is wet. You'll remove your gloves, put the patient in a comfortable position. You'll then remove your face shield and any additional PPE, wash your hands, and then go back in and check with the patient within the appropriate time frame for evaluation. Administering an intramuscular injection, you need to draw the solution up from a vial or an ampule, or it could be in a pre-filled syringe, and you will make sure that you keep the medication on your body and in your eyesight at all times. You'll perform your hand hygiene and put on your PPE if necessary. You're going to identify the patient by either checking the name on the ID band, checking the ID number on the ID band. You can check the birthday or the patient's on the patient's identification band, or you can ask the patient to state their name and birthday and compare it to the EMR. You'll want to close the door to the room and provide privacy and scan the barcode on the ID band. You will put on clean gloves and select an appropriate administration site. You will assist the patient to the appropriate position and provide a drape if necessary. You'll clean the site with an antimicrobial cloth and allow it to air dry. Also use a firm circular motion and clean from the site of the injection out. Remove the needle cap by pulling it straight off. You'll want to displace the skin in a Z-track manner, so you'll pull the skin and the underlying tissue down on one side with your non-dominant hand and hold the skin and tissue in this position. You should keep your hand and fingers in this position while giving the injection to give proper identification of the landmarks and ensure safe injection technique. Quickly dart the needle into the tissue so the needle is perpendicular to the patient's body at a 90-degree angle. As soon as you have the needle in place, you'll use your thumb and your forefinger to lower the end of the syringe, making sure not to displace the skin or the tissue, and slide your dominant hand to the end of the plunger. You'll also inject this solution slowly at 10 seconds per ml of medication. Once the medication has been instilled, you'll want to wait 10 seconds before withdrawing the needle, and you'll want to do that smoothly and steadily at the same needle that you inserted the needle. Do not recap the used needle. Dispose of it in the proper receptacle. You can apply gentle pressure at the site with a dry gauze. Do not massage the area. You can place a Band-Aid over it if necessary. Get the patient in a comfortable position. Take your gloves off and your PPE, wash your hands, and then check back with the patient, document the administration of the medication immediately and evaluate the patient's response to the medication in the appropriate time frame. You should also assess the site for any redness, swelling, or irritation, if possible, within 2 to 4 hours after administration. When applying a transdermal patch, you'll want to transport the medication to the patient's bedside safely and keep the medication in your site at all times. Perform hand hygiene and use your PPE when necessary. You'll identify the patient by checking the name on the identification band, checking the date of birth on the ID band, checking the identification number on the ID band, or ask the patient to state his or her name and birthday and compare it to the EMR. You'll scan the barcode on the band, put on your gloves, and you'll assess the skin where the patch is to be placed, making sure there's no irritation or breakdown present, no redness, and the site should be clean and dry and free of hair, and you should be certain to rotate application sites. If there are any transdermal patches on the skin already of the same medication, you'll want to be sure that you remove those prior to placing the new one. You'll fold the old patch in half with the adhesive side sticking together and throw them away according to the policy of the facility, and wash the area that it was placed with a disposable washcloth or soap and water to get that adhesion off. You'll remove the new patch from its protective covering and do not touch the medication surface. Apply the patch to the patient's skin and use the palm of the hand and press firmly for 10 seconds. Do not massage the area. You'll and write the date and time of administration on the patch or on a piece of surgical tape and place it close to the area of the patch. Remove your gloves and additional PPE, perform your hand hygiene, immediately document the administration of the medication, and be sure to follow up within the appropriate time frame of administering the patch. Administering eye drops. Be sure that you transport the medication to the patient's bedside carefully and keep the medication inside at all times. Perform your PPE and put on your gloves. Check the identification number on the patient's ID band. Check the birthday on the patient's ID band, or have the patient to give you their name and date of birth and compare it to the EMR. Scan the barcode on the ID band, put on your gloves, and offer the patient a tissue. You'll want to clean the eyelids and the eyelashes of any drainage with a washcloth or a cotton ball, gauze squares that have been moistened with water or a saline solution, and use the area of the cleaning surface once, going from the inner eye to the outer. You'll tilt the patient's head back slightly if they're sitting or over a pillow if they're lying down. The head could be turned slightly to the affected side to prevent the solution or the tears from going into the opposite eye. Remove the cap from the medication bottle and be careful not to touch the inner side of the cap or the tip of the container. You will invert the plastic container that is commonly used to instill eye drops, and you'll have the patient to look up and focus on something like the ceiling or the light. You'll place your thumb near the margin of the lower eyelid right below the eyelashes and apply pressure downward, and that exposes the lower conjunctival sac. And rest your hand on the patient's forehead just above the eyebrow, squeeze the container of eye drops, and allow the prescribed number of drops to fall into the lower conjunctival sac. Apply gentle pressure over the inner canthus to prevent the eye drops from flowing into the tear duct. And make sure that you instruct the patient not to rub their eye, and then replace the cap back on the bottle of medication. You'll remove your gloves, assist the patient to a comfortable position, remove any PPE that you used, and perform your hand hygiene. Immediately document the administration of the medication and evaluate the patient's response to the medication within the appropriate time frame. Administrating eardrops. You'll want to be sure that you transport the medication to the patient's bedside carefully and keep the medication inside at all times. Wash your hands, put on your gloves, and use your proper PPE when necessary. You will check the patient's identification using the ID band. You can check their name, check the identification number, check their birthday, or you can ask the patient to say his or her name and birthday based on the facility policy. You'll scan the patient's barcode on the ID band and put on your gloves. Be sure that you cleanse the external ear of any drainage with a cotton ball or a washcloth that has been moistened with water or natural saline. You'll remove the cap from the medication bottle and be careful not to contaminate that or the tip of the container. You'll straighten the canal by pulling the portion of the pinna up and back for an adult. You'll invert and hold the medication bottle into the ear with the tip just above the auditory canal, and do not touch the dropper to the ear. You'll squeeze the container and allow the drops to fall onto the side of the canal. Don't drop it directly into the canal or directly onto the tympanic membrane. After you instill the drops, you can release the pinna and have the patient maintain their head out of position to prevent the drops of medication to come back out of the ear. You'll gently press on the tragus a few times, and if ordered, you can place a piece of cotton in the ear to keep the medication from coming back out as well. You'll want the patient to lie down with the affected ear in an upwards position for at least 5 minutes. Put the cap back on the medication bottle, remove your gloves and PPE, document the administration of the medication immediately, and evaluate the response to the medication within an appropriate time frame. Administering a nasal spray. You'll want to ensure that you transport the medication to the patient's bedside carefully and keep the medication inside and on you at all times. Perform your hand hygiene and use your PPE as indicated. You'll want to check the identification of the patient by checking the name on the ID band or the ID number or the date of birth, at least two of the following methods, or at least two of those methods, and ask the patient to state his or her name and birthday based on the policy of the facility. You'll scan the barcode of the patient's ID band and put on your gloves. provide the patient with tissues and ask him to go ahead and blow his or her nose, and you'll want the patient to sit upright with the head tilted backwards. You'll instruct the patient that it is necessary to gently inhale through the nose as the spray is being administered. Agitate the bottle gently before spraying. Insert the tip of the nose piece or of the bottle into one nostril, and you'll want to occlude the opposite nostril with the finger. Instruct the patient to breathe in gently through the nostril and compress or activate the bottle to release one spray at the same time that the patient inhales. You'll keep the medication container compressed and remove it from the nostril, and do not allow the container to return to its original position until it's removed from the patient's nose. You'll have the patient to hold their breath for a few seconds and then breathe out slowly through the mouth. Repeat in the other nostril if prescribed to be administered that way. You'll want to clean the nasal nose piece with a clean, dried tissue or a cloth and then replace the cap. Instruct the patient not to blow their nose for 5 to 10 minutes. Remove the gloves and put the patient back to a comfortable position. Remove any additional PPE if used and perform your hand hygiene. Immediately document administration of the medication and evaluate the response to the procedure and medication within the appropriate time frame.